Dr. Baliga here. This podcast is on vitamin D in COVID patients. As the summer looms and we get more sunlight, we would expect a decreased burden of flu infections, and similarly we hope that there will be a decrease in new cases of COVID patients. And of course, it is attributed to sunlight and vitamin D. Today we'll discuss the possible role of vitamin D in COVID. One is a preprint paper titled The Possible Role of Vitamin D in Suppressing Cytokine Storm and Associated Mortality in COVID-19 Patients. The corresponding author is Dr. Vadim Bachman from Northwestern University. The other authors on this paper are from Boston Medical Center. Another important article is a Lancet article titled Vitamin D and COVID-19 to Deficient Risk, a Poorer Outcome, authored by Dr. Fiona Mitchell. It's well recognized that vitamin D plays an important role in calcium and phosphate balance, affecting bone growth and turnover. Low vitamin D levels are also associated with other non-communicable diseases and with increased susceptibility to infectious diseases, particularly upper respiratory tract infection. It remains unclear whether vitamin D is a consequence or a cause of respiratory tract infections. Intervention trials have rarely shown benefits of vitamin D supplementation as treatments or preventive measures. However, there was one important exception. It was a BMJ 2017 meta-analysis published in volume 356 and authored by Dr. Adrian Martineau from the Institute of Population Health Sciences, Barts, and the London, Queen Mary University of London, UK. The meta-analysis of individual patient data from 11,321 participants in 25 randomized controlled trials showed that vitamin D supplementation protected against acute respiratory tract infection, and that patients with very low, that is less than 25 nanomoles per liter, serum 25 hydroxy vitamin D concentration, a marker of vitamin D status, gained the most benefit. Given that the pandemic is in its early stages, all data is circumstantial, but there is a growing evidence which links outcomes of COVID-19 and vitamin D status. In a cross-sectional analysis of COVID-19 mortality and vitamin D deficiency published in the Irish Medical Journal 2020, volume 113, page 81, COVID-19 mortality was significantly associated with vitamin D status in different populations in Europe. In addition, Black and minority ethnic individuals who are more likely to have vitamin D deficiency because they have darker skin seem to be worse affected than white people by COVID-19. Data from the UK Office for National Statistics shows that Black people in England and Wales are more than 4 times more likely to die from COVID-19 than are white people. What is the postulated mechanisms for potential benefits from vitamin D? First, vitamin D supports production of antimicrobial peptides in the respiratory epithelium, thus making infection with the virus and development of COVID-19 symptoms less likely. Secondly, vitamin D might help to reduce the inflammatory response to infection with SARS-CoV-2. Dysregulation of this response, especially of the renin-angiotensin system, is characteristic of COVID-19, and the degree of overactivation is associated with a poor prognosis. It's well known that vitamin D interacts with a protein in this pathway, that is the angiotensin converting enzyme 2, ACE2, which is also exploited by the SARS-CoV-2 virus as an entry receptor. While SARS-CoV-2 virus downregulates expression of ACE2, vitamin D protects expression of this gene. Thirdly, vitamin D can suppress cytokine production by simultaneously boosting the innate immune system, thus reducing the viral load and decreasing the overactivation of the adaptive immune system to immediately respond to the viral load. Some researchers have suggested the potential role of vitamin D in suppressing cytokine storm during the 1918 flu pandemic, and the data from the Northwestern Boston Medical Center group, which is in the preprint server, reported a possible link between high C-reactive protein and vitamin D deficiency among the elderly, that is, above the age of 60 years in low-income families. Given that C-reactive protein is a surrogate marker for cytokine storm and is associated with vitamin D deficiency, their paper, based on retrospective data and indirect evidence, see a possible role of vitamin D in reducing complications attributed to unregulated inflammation and cytokine storm. Indeed, there is no randomized controlled trial evidence, but we are in the middle of a pandemic, and one could argue, how long do we need to wait in the context of such a crisis? Vitamin D is a micronutrient and essential for bone growth and musculoskeletal function, so one would argue that we should be taking it anyway. Vitamin D can be obtained through foods such as salmon, egg yolks, and fortified milk. However, 5 to 30 minutes of sunlight exposure twice a week is usually sufficient to meet people's vitamin D needs, including those living in northern latitudes such as Minnesota. There is good evidence that excessive intake of vitamin D can be harmful, particularly in those with kidney problems.